A major goal in a girl with PCOS in management terms is to reduce the insulin resistance, and the most important aspect of course is the lifestyle measure and reduction in weight. One medication which is specifically helpful and has been used in hundreds and thousands of girls across the world with PCOS is metformin. Metformin is an insulin sensitizer which increases the insulin action largely at the level of liver, and it is also used as treatment for diabetes. So many of the pharmacists, many of the relatives, when they read that okay, this girl has been prescribed metformin, do object and say, okay, why are you taking a diabetes medication? Now what we need to remember is that metformin, although it's used for treatment of diabetes, is primarily a medicine to improve insulin resistance, which is central for the problems in PCOS, and this has been approved in the treatment of girls who have insulin resistance along with PCOS. It should be used only under careful supervision by an endocrinologist because there could be many adverse effects which we watch out for. One of the major concerns of girls with hyperandrogenism and PCOS is the period irregularity, and therein comes the role of estrogen progesterone preparation. These preparations are a combination which provides ovaries rest, which suppress LH and FSH level, improve ovarian physiology, and often may result in resolution of all these symptoms. Once again, many times people think that these are birth control pills, quote unquote, and they say, why are we giving this to our girls? While they are used for birth control, they are primarily the same hormones which the ovaries produce. And when we use estrogen and progesterone, we are suppressing the gonadotropin levels and reducing the impact on the ovary. In a way, we are giving rest to the ovaries. So estrogen progesterone pills are the primary treatment of PCOS and has been used extensively across the globe. They should be used with caution. We have to look at things like blood pressure, presence of headache, history of thrombosis in the family, but when used carefully, they are absolutely safe and effective. The usual course of PCOS is that once we start this estrogen progesterone preparation, there would be improvement very quickly in terms of cycle control. There will be benefit in acne and hair fall, but the effect on hair growth may be delayed. This is because hair growth is a long process. It takes 6 to 12 months for hair to mature, and what we see on the face are essentially dead hairs. So there would be no impact of treatment which we are giving now on dead hairs. For that, we can think of cosmetic measures. The effect of any treatment in terms of hair growth will take at least 6 months to come. If a girl is not responding to treatment for after 6 months, we check at the hormone levels, we see if there are other diagnoses, and we think of alternate treatment as well. In the meanwhile also, if there are concerns about excessive hair growth, we suggest cosmetic measures like waxing, like epilation, or the use of razor also. In some girls who have persistent hair growth despite estrogen progesterone, we use drugs which alter the action of testosterone to decrease the hair growth. In girls who have significant hirsutism or who are not responding to medications, there is a role of laser treatment for the permanent removal of hairs. Polycystic ovarian syndrome has a lot of implications in terms of future fertility, and it's very important that we correct it during the adolescent period. Girls who have persistent polycystic ovarian syndrome beyond 18 years are more likely to have it through adulthood, and it may become very, very difficult to treat. So it's very important to identify the condition early and manage it accordingly.